I'm Peter Block at ACC 11, and with me is Dr. Ted Feldman. No, Ted needs no introduction. He has been the maitre d' of the Everest trial, the percutaneous mitral clip for mitral regurgitation. Ted, at 1 year, the lines after the initial sort of dip that happened in patients who did not have great outcomes initially, the lines between surgery and the clip have been relatively parallel. Now we have 2 year and even some longer follow-up. So tell me what you're finding at 2 years.
Well, just to sharpen up the 1 year findings, we found, as you would expect for a catheter-based therapy compared to open surgery, greater safety at 1 year on a 30-day endpoint. At 1 year, we found that the reduction in mitral regurgitation with surgery is better than with a clip, that both therapies show improved left ventricular chamber volumes, and that interestingly, even with the differential in MR reduction favoring surgery, that New York Heart Association class 1 and 2 was much more frequent in clip patients. They felt better.
Perhaps not surprised because they went through an operation or something. It's hard to know what drives that, isn't it?
It is hard to know.
Yeah.
It may be that we're not measuring the MR results correctly, and we can come back to that. But we find at 2 years that the Kaplan-Meier curves are absolutely flat. So there's been no change in mortality, which has been equal in both groups all along. There's no difference in the recurrence of 3 or 4 plus MR, which again, both groups the same all the way along. And what drove the difference between the therapies was the need for early surgery in clip patients where we didn't achieve a good result. Between 1 and 2 years, only one additional patient in each group had subsequent surgery. Now, we have complete follow-up out to 2 years. We have several patients now out to 3 years,
right, and
the lines are still flat. And I think that is very encouraging because we have one surgical report from Ottavio Alfieri, who invented the surgical procedure on which this is based, that actually goes out to 12 years with good results. And not seeing a fall off in this 1 to 2 year period, I think, is tremendously encouraging.
Good news. So I guess the surgeons have always said, look, we always put it in an annular ring. This is never going to work, and yet it seems to be. What's going on? Short version.
Well, there's several things. One is that we selected patients with relatively better LV function than are in a lot of the surgical series, so that the dilated hearts are not, and annuli are not as big a part of this population. A second thing is that we are coapting the edges of the leaflets. This develops eventually a scar and a tissue bridge.
Right.
And we didn't present it today, but we have tethered the annulus. And we actually see smaller septal lateral dimensions at a year than we do at baseline. So that we're probably doing something to the annulus.
So this clip may in fact be different than the stitch in terms of what it does to the mitral valve and the annular hold, if you will.
Yes, it's a fundamentally new therapy.
Great, so optimism from the Everest trial.
Well, and you know, the numbers now jive with what we see in individual patients. And I have individual cases that go back 8 years now, in whom we had some residual MR, and 5, 6, 8 years later, we still have small ventricles and fully functional patients who feel great.
Thank you, Ted.